Kathleen Sebelius is the Secretary of Health and Human Services. Secretary, you released a statement today saying that your policies remain unchanged. So what are you specifically recommending?
Well, Katie, what I know is happening across America, because it's certainly happening here in our office, is that women have looked at the Prevention Task Force recommendations that change some of the protocol about mammogram screenings on a routine basis and wondering what to do. And our recommendations really are do what you've always done. Read the task force report, but then talk to your doctor. And, you know, one of the reasons that we're working so hard on health reform is over 20 million American women and girls don't have a doctor, don't have a health home, and we'd like to close that gap so every woman can have an opportunity to take advantage of the great technology that can identify breast cancer at a much earlier point.
Well, are you refuting the recommendations by this panel?
Well, we're not refuting them. It is one panel of scientists and health officials who have actually waded into an area where the recommendations have gone back and forth for years. There unfortunately remains a lot of confusion about what age is the appropriate age to start routine screening and how many times a screening mammography should be given. So we think this is one more piece of evidence. It should be reviewed, but certainly the individual woman should have a conversation with her doctor. Everybody's health history is different. Everybody's body type and family history is different, and those become the critical factors when you're looking for breast cancer.
Well, doesn't this panel fall under the purview of the Department of Health and Human Services, which you run?
Actually, it's an independent group of scientists and advisors, so they don't work for HHS. They are appointed independently. They are doctors and health professionals who actually look at the evidence, make recommendations, but they have no policy-making authority. We make the policy, and we wanted to put out the statement today to first clarify that no coverage changes will be coming, that Medicare will continue to pay for mammograms, Medicaid will continue to pay for mammograms, and frankly, I'd be stunned if private insurers change any coverage decisions.
Why would you be stunned? I mean, how do you stop insurance companies from using the panel's recommendations that there's no blanket recommendation for women starting at age 40 to get a baseline mammogram? Why would you think that private insurers won't take advantage of that and stop covering them?
Well, at least the statement issued today by the health plans indicated that if there was a doctor recommendation that a woman have a mammogram, they were likely to follow it. So I'm taking them at their word. I hope that's the case. What we know is that mammograms can be very effective. They can be a great screening tool. And, you know, my aunt died at 33 of breast cancer, leaving behind 5 children. We've made a lot of progress since then, and we want to make sure and continue to do the research on what the next best screening technique is, and that's what the National Institute of Cancer is determined to do, is really update and upgrade how we determine cancer at a much earlier fashion, how we figure out who's more likely to get it, and how we go after this disease as early as possible and stop it from being the #2 cancer killer for women.
Republicans are already out there saying, let the rationing begin. This is what happens when bureaucrats make your health care decisions. What's your response to that?
Well, it's unfortunate that once again the attempt is to, first of all, skew the data, and secondly, to make this a very partisan political debate. This is a panel actually appointed by President George Bush, folks who have been on this group for a long time, who were given the job of looking at a variety of services and making recommendations based on the science. That's just what they've done. They don't make policy. They won't make policy.
Really sounds as if you're trying to distance yourself from them.
Well, I think, Katie, what's important, knowing that the American Cancer Society has a set of recommendations, the Komen Foundation has a different set of recommendations. There are patient advocacy groups working on cancer who have supported this panel's finding, and others who disagree with it. So we need to continue to do research. We need to look at the best evidence. But most importantly, we need women to talk to their healthcare providers. We need them to have an individual conversation on what's best for them at age 30 and 40 and 50 and 60.
But if there's not a strong government recommendation, are you concerned that women will use this as an excuse not to get screened at all, or doctors may not emphasize the importance of early detection to their patients?
Well, what we know is that, unfortunately, right now, prior to the task force recommendations, 1 out of every 3 women didn't get mammograms on any kind of regular basis, did not have screenings, and that's over the age of 50. So we've got a big gap to fill.
Well, are you worried this will make it even worse?
Well, I hope that what it will do is call attention to the fact that mammograms are very important. The controversy, I think, will actually help educate folks about what's appropriate, what's being called for. This recommendation says over the age of 50, every 2 years, everyone should have a mammogram. Under the age of 50, it shouldn't be used routinely, but it should be an individual conversation based on health history. That would actually be a big step forward, but we want to make sure that no one decreases their preventive coverage, that we continue to move forward on breast cancer detection and breast cancer cures.
Radiation and needle or even surgical biopsies that find no cancer are clearly not optimal, but they won't kill you. Not detecting breast cancer early, if you're in your 40s, can. So how do you square those two things?
Well, I think, again, that's why you need a doctor and individual conversations. No panel of anybody should make policy decisions, and that isn't what's going on. What these scientists and medical providers were asked to do is look at the risks and look at the benefits, and they've done that based on scientific evidence. But as you know, you and I are not one statistic. We're a live human being. I certainly want my friends to talk to a doctor. I want my friends to have a doctor to talk to. And again, that's why we're fighting so hard here for health reform. So everybody has a health home. Everybody gets preventive care. Everybody has that opportunity to use the best technique possible and make sure that they have the advantage of getting that recommendation on an individual basis.
Given that a health care reform bill is currently, as you well know, winding its way through Congress, how bad is the timing of these recommendations in your view?
Well, I think anything that has to do with health these days is likely to be made a partisan debate. And again, I think it's very unfortunate that the panel that has been in place for years, has been appointed by previous administrations, is full of scientists, is now being looked at as somehow evidence of things gone awry. Nothing could be further from the truth. We want the best evidence possible, but then you need to have a doctor and a patient discussion. We want women to look at the evidence, but then have a discussion with your doctor. The statement is issued to clear up the confusion. We don't want women all over America trying to figure this out on their own. So they've got a group of scientists who don't know them, who don't know their health history, who don't know their family history, making a national recommendation, and then they need to take that evidence and take it to their health care provider.
The American Cancer Society, the Komen Foundation, and various doctors' groups are telling women to ignore these guidelines. I mean, isn't there a better way? Isn't this only creating a huge amount of confusion?
Well, Katie, the panel does what they have been asked to do on a regular basis, which is update preventive information. The last time this information was put together was 2002. They've looked at a lot of evidence since then, and they put out a new set of recommendations. They'll continue to do that on a whole range of topics. They have no policy-making authority. They have no benefit authority. All the health bills, all the policymakers put that authority in a separate body. So I think we want the scientific evidence to inform, but we want individual patients and doctors to make their own health care decisions, and that's exactly what's anticipated in health reform. But we need everybody to have a doctor. We've got 21 million women who have no health home, who have no regular preventive care, who have nobody to discuss this with, and that's really part of the health reform discussion in Congress.
Kathleen Sebelius, Secretary of Health and Human Services, thank you so much for your time.
Good to talk to you, Katie.